First, I'd like to do a quick roll call. If folks would just let me know if they're here or their designee. Carl Schitchel. I always get your name wrong. I apologize on that one.
And say Carl from CHA. I'm here and thank you.
Thank you. And Jacqueline Santiago from Compass.
I am here.
Leonard Jihad, CTVIP. Ebony Epps, RACEP, Safe Streets.
RACEP, Street Safe, I'm here.
Oh, Street Safe, thank you. Andrew Woods, Chair, obviously present. Yeah. Jeremy Stein, CAGB.
Good afternoon, everyone.
David Shapiro, St. Francis Hospital. Dr. James Doddington, Yale New Haven Hospital.
Present, thank you.
Dr. Charles Jondro, Hartford Hospital. I believe he might be a few minutes late for us today. Dawn Spearman, You Are Not Alone. Deborah Davis, Mothers United Against Violence.
I am here.
Beautiful. And welcome. And Mark Ortman from the Hobby and filling in for Kyle Fisher.
I'm here. Hi, everybody.
Hi. And Michael Miskowski from Connecticut DPH.
Here.
And Colleen Violette from DPH as well.
Yep, here.
Sure, beautiful. Welcome, everyone. Did I miss anybody? And I believe I see our executive director here, Stephen Hernandez. Welcome.
And it appears we may also have our Maryland Senator Moore.
Senator Moore.
Joined us as well.
Welcome.
Thank you.
And I'll turn it over to our chairman, Andrew Woods.
Okay. I believe we welcome everyone. I believe the minutes, did we get the minutes out? Folks had a chance to review those minutes by any chance? Pina.
I can put them up on our screen here.
Okay, great.
A second or a few.
Sure, give it a minute, folks. And it's been a lot of work that's been done in the background, putting together a lot of content. As many of you know, we've gotten to each of you related to our work groups and the establishment of the work groups based on your recommendations from the last meeting. And so we may not have time to have gotten those minutes out, but we'll certainly look to get that in advance to you during the next meeting. And we'll, once Pina pulls that up, we can see what we got going on.
Having a hard time on my end for some reason today. Sorry about
So
that.
how about in the
We can
interim?
We can
Right.
keep going, Andrew, and
Yes,
then I'll pop
absolutely.
them up.
Right. So in the interim, thanks everybody for coming back and joining us again today. And for those of you who are viewing, we're glad that you're able to join us as well. By the end of this program, we will also get out to folks an invitation for a public hearing that's going to take place in November 17th, to be exact, from 5 to 8 p.m. And that will be a public hearing that we're hoping that many of you that are viewing this this program today, our engagement today, as well as those that are a part of the advisory committee, that we would seek to get as many folks from the general public to speak and testify and share the way that you view the issue of community violence, as well as what you believe might be or could be practical ways of which we can address this issue. And we also have a public safety hearing that will be on prior to that, November 5th. That's where we will also hear from law enforcement officers related to the way that they view public safety in ways that they believe the public and the legislature and those of us that do violence prevention, intervention, and recovery work, the way that we too can also look at ways to work together and to resolve this issue or to mitigate the issue of public safety. And so we'll get that information out to you as well. Today's agenda, which is basically that we're going to be covering, will be subcommittee work groups, as well as followed by an outline one of the ideas of presenting and producing an outline, which is the outline I'm referring to, is actually the outline of what the report can potentially look like. And that way, we're somewhat working backwards to where we can give not only members that are on this committee an idea on what we need to do to populate this report, but also the urgency of which we need to get information to make sure that we're addressing and hitting on all of our mandates. And so, Pina, I see that you pulled up the
minutes here.
the minutes
Yes.
from last week and or a few weeks ago. And I'm not, if you can scroll through that, it looks like folks, if anyone on the membership side is not listed here, if you can catch that now, that'd be great. If your name's not there or someone is missing, you can let Peter know that, as well as the administrative staff. They were present, I can see. And then pretty much we did go through these action items or the some of the points here where we announced the or part of the action items would be to announce the 5 committees, which we'll be doing today, the formation of those working groups, as well as the public health hearings, which I just mentioned that we will also get out to you. The additional future meetings. Now, all of the members of this committee do have the remaining meeting dates that we have scheduled, but we want to make sure that there's a way that the public too can also get access to that as well, to know when each and every meeting will be coming up. The other action item that I mentioned.
Excuse me, Andrew, those should be on all of your agendas and in your calendar invites. You should have them all there for you.
Okay. In terms
Excuse
of
me,
the public,
Andrew.
that's not a problem. In terms of the public, Pina, when they do have the link to this, but do they also have when the upcoming meetings will be, so they don't miss meetings?
Yes, they're on the bulletin and we'll make sure that they're included there again, Andrew. So
Okay, fantastic.
yeah,
Thank you.
I'll follow up on that.
Great, thanks. And then, of course, we'll be covering the template of what the final report can potentially look like. And again, we didn't populate content. We really just populated an outline of what that particular report could look like that we would be submitting to the legislature. And so scroll down just a little bit more past your other boxes there, other screens, Pina. Okay, all right, that was pretty much based on the action items. The action items derived from some of the conversation that we had during the last meeting. And so the previous meeting was really coming together, everyone seeing faces, everyone knowing who's in the room, and then pretty much having a conversation on what we can expect for the next meeting, which we are here today to discuss. And so if there's other additional detail, and I think there is, that should be inside these minutes, this report here, we got to loop back around and add some more context to our minutes moving forward. So we can talk about that later.
Yeah, I mean, we had just spoken about just given action items, and since these are recorded, Andrew, but if the committee would like something different, let me know and we'll be happy to do that.
Okay, cool. Very good. Okay, so why don't we move to, which is our next part of the agenda, which is actually the subcommittee work group structure. If Peter will pull that up and enlarge that on the screen. Okay, so we've broken it down based on our conversations and the interests of our current members into 1, 2, 3, 4, actually it's 4 work groups, one of which is the evidence-based programs, and we can start from the top. There you go. Community engagement and public health work group. And this particular work group is led by Deborah Davis of Mothers United Against Violence, as well as from a public health side, Michael Makowski from the Connecticut Department of Public Health. Even in today's presentation, you'll be hearing from Michael in terms of an overview on what public health looks like, or victimology or victimization looks like, and also some of the other context related to this. But also Deborah Davis will also share a few words as well as to some of the initial engagement strategies that her, as well as the members of this work group, which is Ebony Heps from RISAP and Dawn Spearman from You Are Not Alone. They're also a part of this particular work group. I'm going to go back to that, Deborah, after I go through all of these, and we can go one by one with each work group lead or co-leads. But part of the duties for this particular work group is to facilitate the collection of community input on the impact of violence and community-centered practices known to prevent and reduce violence and support victims of violent crime. Also to facilitate the collection of non-lethal and lethal violence data, and then to recommend community-centered and public health practices, strategies, and programs that could prevent and reduce violence and support crime victims. Finally, to submit a narrative detailing the steps taken to address the mandates, the results of these steps, gaps uncovered, and recommendations. And also what we've done with each work group is that we have 5 mandates, and each work group, we wanted to make sure that we hit on all the points, make sure that we were to address the mandate. So here with this work group, they pretty much touch on solidly mandates 1 and 5. Next work group. The next work group is the policy and funding work group. And the co-leads here are Carl Schitzer with the Connecticut Hospital Association, as well as Jeremy Stein with Connecticut Against Gun Violence, with their members, Deborah Davis and Jackie Santiago from Compass Youth Collaborative. And the duties here is to inquire and facilitate the collection of known sources of local, state, federal, and foundation funding and policies that support or could support violence prevention, intervention, and support for crime survivors and their families. And then here too, to recommend those policy and funding sources, or recommend, one, present what those recommend, what exists, but also what are some of their recommendations to actually gain the support or policies and fundings to address the issue of violence prevention, intervention, and recovery. And by the way, folks, with each of these work groups, we will try to squeeze in or pepper in, each work group will be doing a presentation to not only us as a committee, but also to those that are viewing this program. But also we will also have other external folks doing presentations, national subject matter experts that we will also be inviting to present in the coming weeks as well. And here, the mandates 4 and 5 are primarily what this work group will be addressing. Next work group. Evidence-based programming and research work group. Here we have co-led by Dr. James Dowdington of Yale New Haven Hospital and Kyle Fisher from the HAVI, the Health Alliance for Violence Intervention, with one of the members, Leonard Jihad from Connecticut Violence Intervention Program. And there may be others that will be joining this work group as well. And their duties here is to facilitate the collection of data on known evidence-based programs and the costs to support, sustain, and enhance these strategies here in the state of Connecticut. Also to identify and elaborate on the role of research and evaluation expertise, including technologies that enhance the comparative and trend data associated with this issue. And again, same as others, to submit a detailed narrative, charts, graphs, you name it, on how we intend to blend their findings into the report. Next work group and final work group. Here we wanted to pull together a public agency work group, which is currently led by Jackie Santiago, CEO of Compass Youth Collaborative, but also we have spoken with a few agency leads to see who we can name to be a part of this particular work group. And a few of those folks are checking in with their governmental folks at their respective agencies, and they will be getting back to us in the coming days, probably no later than Tuesday of next week. But we certainly have as members of this work group, Colleen Vallette, who's with DPH, Brian Foley also, and then we'll be looking for other external partners to become a part of this work group as well. And here, what we're looking to do is to identify strategies to align agency resources to prevent and reduce violence and to support crime survivors, to identify strategies to coordinate these resources and services with the newly established Office of Gun Violence Intervention and Prevention. And finally, of course, like other work groups, submit their findings so that we can incorporate that into the plan. So why don't we go back up to Ms. Deborah Davis. And again, here you're going to hear from folks, each of the leads or co-leads of each work group, just to give the audience as well as those of us on this committee a sense on any of the steps they've taken so far. Ms. Davis.
Okay, thank you so much, Andrew. Our group actually comprises of a good number of folks that are from outreach grassroots locations and organizations that have been doing this work for over 15 years or so. And so our group has a really good understanding of how to really lean in and capture most of the data, most of the other groups that are actually doing things in the community. And since we've been involved specifically with the community engagement, public engagement, our group members are now really charged with, and we've been making a list of other groups that are basically doing this work, and they have been out there. We also are wanting them to make certain that we look at what has worked and what hasn't worked, which is really important. And so as part of this mandate, we want to make sure that individuals that will be speaking will be able to attest to the fact that what they're doing in terms of their model, that it is working. And since it is a grassroots led kind of an initiative, we want to make sure that those voices that have not normally been heard, that they will be heard in this venue and with this space, with this commission. And so that's really important as we tie right back into what our public health expert has on the board as well. So we just want to make sure that those voices, as we go around the state in different areas, Bridgeport, New Haven, et cetera, we want to make sure in the Hartford area that we capture all of those voices that have resonated of doing the work and that they've been really actively engaged over an extended period of time. And it has been working. And that's really key for us. So with that, I'll just turn it back to you, Andrew. And as we stay really aligned with the mandate that we're actually working towards as well. And we will have those that information as well.
Thank you. Thank you very much, Deborah. Appreciate that.
Yeah.
Anything else from any of your other work group members?
No, and Deborah, I just want to say, if you need any help having anybody sign up with testimony or anything for the
Yes.
17th, just reach out and I'm happy to help.
Okay, I definitely will. I'll do that. Thank you, Pena. Thank you, Andrew.
Welcome.
All right. Okay, hearing none, we're going to move on to the next work group. Here, the policy and funding work group, Jeremy Stein and Carl Schitzel. It's my understanding that, Jeremy, you will be leading the conversation on this or providing us with the update.
Sure, thank you, Andrew. So I'm really grateful to be working with Carl from the Connecticut Hospital Association, as well as Jackie Santiago, who will be on the committee with Deborah Davis from Mothers United Against Violence. And I think Deborah also hit the nail on the head. In terms of this council inclusiveness, right, has to be at the center of this. What we know from the policy side is this is a public health crisis, right, first and foremost. And so the policy and the funding have to be driven together, because that's really what we're talking about at the end of the day, is trying to get the state to invest more on gun violence prevention models, on community-centric, evidence-based models. And I think it is a good starting point to kind of frame this work that we'll be doing in some recent news. Yesterday, the state of Wisconsin announced that it is investing $45 million into gun violence prevention, $8 million which will go directly to Milwaukee's Office of Gun Violence Prevention. So our task as an advisory council is to, inform the Public Health Committee on the creation of a similar type of commission to combat community-level gun violence. And so, this council was kind of born out of the idea from the Connecticut initiative of getting this kind of state-level funding, community-centric solutions that are evidence-based, and to try to make sure that we are investing in all of the organizations that are doing prevention work, intervention work, and aftercare, and looking at tried and true models that have worked not just in Connecticut but around the country, and to look at community violence interruption work, hospital-based work, hospital violence interruption, and as well as group violence intervention, and to look at those models and to see what we can be doing better in Connecticut, and to fund those solutions that do work. In terms of the funding side, we have been in contact with national partners, Community Justice Action Fund we had a meeting with yesterday, and then two of the fundings that we were going to be, or potential funds that we're going to be looking at, are the Build Back Better Act, which is pending before Congress, and as well as the Break the Cycle of Violence Act, which is Cory Booker's bill, both of which our senators, our congresspeople support. But there may be other solutions as well, VOCA funding, Burn JAG, and things like that, which we'll be looking closely at. We do have a initial meeting scheduled for October 25th at 10 a.m. That'll be our first kickoff meeting. And like I said, we're hoping to have very focused conversations on creating some policy that can really change lives in Connecticut.
Jeremy, thank you very much. Carl, anything to add?
One of the virtues of having a co-chair is applauding them when they do fantastically well. No, I think, Jeremy, you said it all, and I'm looking forward to working with you and Deborah and Jackie on this work group. And I'm very inspired by the possibilities here. So thank you, Jeremy, and thank you, Andrew.
Thank you, Carl. Okay, the next work group is the Evidence-Based Program and Research Work Group, led by Jim Doddington, Kyle Fisher, and Leonard Jihad as one of the members of this group. And Jim Doddington will kick off the update. Jim?
Thank you, Andrew. Hearing the other work groups present, I think our first and foremost goal is to work in a synergistic way with everything else everyone is doing. I'm excited to be joined by Dr. Kyle Fisher at the Javi in this endeavor. We were able to put together just a short rubric of some of those evidence-based practices that are out there, very similar to the kinds of programs that Jeremy just mentioned. We are going to be focusing on hospital-based interventions, street outreach, violence interruption, of course, by representatives on our group, particularly with Jihad on our team, violence reduction strategies like Project Longevity, group violence intervention, as well as targeted trauma-informed care, peace fellowships, survivor and family assistance groups. Particularly, we'd like to try to find evidence around trauma recovery centers, of course, Mothers United Against Violence, we're going to love to hear from. Also, there are potential place-based interventions that are impacted by groups that are definitely doing great work in Connecticut that are our potential partners. And then specifically, we are tasked with looking at technology, and we are already involved and partnered with some technology innovations around hospital-based interventions, case management software like Penelope software, that's a very prominent HVIP software, and then some emerging technologies around violence interruption tracking and data, particularly leaning on our CTVIP partners and Leonard Jihad that's been working in some innovation there. So we're very excited to get started. We are very open to any collaborators, so looking to reach out to academic collaborators at UConn, at Quinnipiac, at Yale, across the state, across the UConn system. So if anyone knows of folks in those fields, please point them towards us, as we'd like to hear from everyone. And I'll leave it there unless Jihad or anyone else has anything else to say.
Hey, thank you very much, Jim. Leonard, Jihad, anything to add on that piece? I know you're driving.
Yeah, I'm just playing catch up. So yeah, ditto what Jim says, and then if I have any other feedback, I'll catch up at the end.
Fantastic. Thank you, sir. Drive carefully.
Absolutely.
Wait a minute, I'm on mute. Sorry about that. The final work group is the public agency work group led by Jackie Santiago and another lead to be determined. And Jackie can bring us up to speed on this. And this group hasn't formed yet, but we wanted Jackie to at least let folks know a little bit about what her charge will be. Jackie?
Yes, thank you. Thank you, everyone. It's my pleasure to co-lead, hopefully soon, with someone from the State Department. And as a part of this work group, we do have members, Colleen Violette from the Connecticut Department of Public Health, Brian Foley, DCF, DSS, OPM, Judicial, and Child Advocate. And others are also welcome. Our duties is to identify and align agency resources to prevent and reduce violence and to support the survivors of crime. And this is, to me, an area that is extremely important for all of the community members. And again, there will be synergy between us and the Funding and Policy Committee, as well as the Community Engagement Committee, because there has to be an effort to bring all of the state agencies together and resources that can better support the community agencies such as myself or even mothers and others who are looking for support for the work that they do, but also a coordination of the services and letting people know what is available when we are addressing the issue of gun violence in our community. So while this group has not convened yet, we do plan on having a meeting next week and then follow-up work committee meetings after that.
Okay, thank you very much, Jackie. Appreciate it, and thank you for agreeing to co-lead this particular work group. Okay, so Pina, why don't we bring up the next slide that has to do with the executive or the report outline. And here, folks, is just a draft, and again, it's just an outline on what the report to the legislature would ultimately look like. And this is, again, our way of organizing and making sure we're organizing ourselves in a way to capture what we believe might be the key aspects of the report that lawmakers as well as the public would want to benefit from seeing, learning from, and then obviously helping to advocate its implementations in its many forms. And so it really starts out here with the origins and scope of the advisory committee, with a public act, with some of the leadership from Senator Moore, as well as some of the leadership from Connecticut Against Gun Violence and their efforts to really raise the awareness around the need for such an office or division within the state of Connecticut. It goes on with the report to point out what our mandates are, which is we have the 5 mandates, which will be highlighted in the report so that folks know exactly what we've been charged to do, which you see listed there. And again, each of the mandates will be addressed by each of our 4 work groups in terms of making sure we hit on all 4 of those points. And of course, you have the work groups laid out there. The report will look such as this, with an executive summary, obviously, background on what got us here, as well as what the issue, the challenge looks like, and what we believe could be key ways of addressing this particular issue. It would definitely point out why a gun violence intervention and prevention advisory committee, to answer that question, why this committee was even brought into existence. And you can see the 3 points there, which is, we've had an unprecedented spike in community violence in Connecticut cities and across America. We've had citizen calls for support to prevent and reduce violence and to support crime survivors. And we certainly have had advocates demand for sufficient funds and sustained resources to support violence prevention, intervention, and treatment and recovery initiatives, including the training and therapeutic support for frontline workers. And then, of course, again, we'll eliminate as many redundancies. We do, again, here speak to some of the 5 mandates. We can go ahead and scroll down. And obviously, it concludes with a summary and conclusion, which is our recommendations for the lawmakers, and that too will be floated back up top and into the executive summary. The membership of the advisory committee, staffing, special acknowledgements, etc. And then, of course, you have all of your work groups, their duties will be included in that report, as well as appendices. And so when we're asking for folks, say, to testify and to present data and information to this committee, that information too would go into the report. It will be added to the appendices, it will be a part of the public record, etc. So anything and everything that comes our way will be made a part of the public record to where folks can come back to and take a look at what information was submitted to this particular committee. And so I'll stop it there and we'll move on to the next phase of the agenda, which is a presentation from DPH, from Michael Makowski, an epidemiologist over at DPH. And Mike, as we indicated earlier, is one of our co-leads with the Public Health and Community Engagement work group, but also he has pulled together a PowerPoint on exactly what this issue looks like to help ground not only those on the committee and ground them in the data around violence and victimology, but also for our general public as well. And so, Pina, we can bring those slides up and bring Mike up.
Yeah. Can you hear me? Or am
We can hear you, we can see you.
Okay. And are the slides up too? Everyone can see that too?
Not yet.
All right, let's hit that one. Now can everyone see the slides?
Not yet.
Give me your-
Getting there.
Double click it on your end, Mike. If not, I'll take it on mine.
Let's see.
Yeah, I'll bring it up on mine for you.
Okay. All right, there we go. As Andrew mentioned, I'm Mike Makowski, an epidemiologist for the at the Department of Public Health. I'm program manager for the Connecticut Violent Death Reporting System. The Connecticut Violent Death Reporting System is a federal program. We have a cooperative agreement with the Centers for Disease Control and Prevention. Connecticut received funds beginning in 2014, and we started data collection in 2015. And we're in our second funding cycle. We're in year 3 of the second funding cycle. So next September, we'll be beginning a new 5-year round of funding. The Connecticut Violent Death Reporting System collects data about victims of homicide, or in this case, victims of violent death, that being suicides, undetermined deaths, and our main sources of data. We initiate our cases from the medical examiner reports. We also, a very large component is law enforcement. I have 2 retired police officers that collect law enforcement data from the police departments throughout the state. So we collect that data. We get data from the state police, from their crime intervention group. And we also get autopsy data and toxicology data. So all violent deaths, the victims have toxicology data done. And another piece is we get data about the victims from death certificate data. And all data in this presentation is from the Connecticut Violent Death Reporting System from 2015 to August 31st of this year. I'll make a few remarks. I just received September data, so I'll throw a few updates in there that won't be on the slides. Go to the next slide. As I mentioned, the 2020-2021 data is preliminary and provisional. The law enforcement abstractors are still collecting law enforcement data for 2020 data, and there's a lag time of probably like a year before we'll start collecting 2021 data. And we haven't received 2020 population data. So the numbers in terms of the rates will probably change for 2020. And this last bullet here, as of the 31st of this year, we had 116 homicides. And as I received data yesterday about September data, we're up to 125 homicides as of the end of September. And there's still pending cases out there, so that number may change. The graph here is a look at the crude homicide rates beginning from 2015 and going to current 2021. And you see during the pandemic in 2020 that we had a very large rise in homicide compared to the 2015 to 2019 period. Homicide rates went up 41% from 2020 compared to the previous 5 years. Next slide. In this slide here, we're comparing the homicide rates. I break the time period down into 2 periods of time. The pre-pandemic period from 2015 to 2019 to the pandemic period, 2021, and going until we hear that the pandemic is done. The first graph on the right is the rate of homicide by race and ethnicity. And we see from this graph that the vulnerable populations for homicide are the non-Hispanic Black population and the Hispanic population. And on the left side, we look at the homicide rates comparing the pre-pandemic period to the pandemic period. And we see that between the non-Hispanic Blacks, they had a substantial increase in homicide rates between the pre-pandemic and the pandemic period, as well as the Hispanic population. Next slide, please. We see, since we've been collecting data, the primary victims of homicide are males. And this little pie chart shows that almost like an 8-to-1 ratio between males and females. The orange little slices, female victims. And we have a special category for female victims who were victims of intimate partner violence. I should also mention included in homicide is intimate partner violence. So we're going to have that piece in there, and legal intervention. So that's all included in the number of homicides in these slides. Next slide, please. We've been concerned with the weapons, the lethal means for homicide. And this little slide here shows us from 2015 to 2021, the two primary lethal means in homicides are firearm and sharp force injury, stabbing. And the top part of the slide looks at 2015 to 2019. And we see that the rate of firearm homicides was about 61 per 100 homicides. And we go down to the bottom of the table and we see that during the pandemic, the number of firearms went up. In 2021, it's even up farther. So the firearm deaths in homicides has increased during the pandemic period. Next slide, please. One of the interesting pieces of the violent death reporting system is that we gather circumstances of the homicide. And in homicide, it's the circumstances are multifactorial. So when you're looking at this, know that multiple areas can be checked off. So for instance, a victim can be in a dispute. Then it escalates to a fight, and then further escalates to an assault. Or in another case that it was drug trade. And during the exchange of drugs, the victim was robbed and then subsequently died as a result of an assault. So you can have multiple factors included. So on the table on the left looks at the data from 2015 to 2019 from the number of occurrences and the rate of per said instrument per 100 homicides. And from that time period between law enforcement and OCME reports, we know 80% of the circumstances. And it's also, the table is also ranked from highest to lowest. And the last bullet here, I mentioned gang involvement. What is interesting, the various police departments throughout the state, they have a different definition of gang. The major departments like Hartford and New Haven, to be considered a gang, it has to be like a nationally recognized gang, like the Bloods, the Crips, and the Latin Kings. And some of these homicides may be the result of geographic groups, such as neighborhoods, and they may not be a member of an organized gang. So sometimes, maybe the term gang may be underreported or overreported, depending on the police department jurisdiction. Next slide, please. Can you back up one more? There we go. One thing that is definitely collective from all violent deaths is toxicology. And maybe one more back, Pina. Let's see. There it is. That one there. All the victims have been tested going back from 2015 to the present. This is a table from 2015 to 2019. And the most common drug tested in our homicide victims is marijuana, followed by alcohol, opiates, cocaine, and benzodiazepines. Next slide, please. So I wanted to look over the period of maybe the last 4 years, with 2021 still being not complete. But I wanted to look at the rates of positive marijuana found in homicide victims by race. And the blue line is Black non-Hispanic, and the red line is Hispanic. And certainly you see from 2018 to the present, the rate of positive marijuana has been a steady increase over that 4-year period. Next slide, please. Then this is a slide of the alcohol results. We know certainly with alcohol that with a blood alcohol content, the BAC of greater than 0.08, you're considered intoxicated. So this is a little slide of the past 4 years from 2018 to 2021 of victims who had blood alcohol contents that are considered to be intoxicated. And in the graph on the right, looking at Black non-Hispanic versus Hispanic, we see for the first 3 years, 2018 to 2020, there was a slight increase in positive blood alcohol contents. And we'll see what the rest of 2021 brings. Next slide, please. I just put this up there. Another anecdotal piece we hear is that a lot of the homicides are a result of retaliation. A lot of times in my police reports, that generally doesn't come through, but you know, that could be certainly an area of intervention, is to deal with retaliation to other acts of violence. And we'll go to the next slide, because this is the major one here. Lifestyle. These are areas in which we can intervene. We know that people, victims of homicide, they're place themselves in high-risk situations, and their lifestyle, as we saw in the previous slides, a history of alcohol and drug misuse can play a role in becoming a victim of homicide. Gang membership, as I mentioned. Criminal history, I didn't have that in the slides, but I'd say a preponderance of the homicide victims had a past criminal history. And the combination of all these in a conversion, similar time and space, and you know, vulnerable people are placed in risky situations. Next slide. Is there any questions from anyone?
I see something in the chat box here, Mike, that says, do you know why it is only looking at Black um, let's see, NH in Hispanic, non-Hispanic and Hispanic in terms of drugs?
I chose that because of they have the highest rates of homicide in the state. So I focused on them. I can certainly look back and see the white non-Hispanic and Asian population. I don't think it will be as the magnitude won't be as high for those. I focused on those with the highest vulnerability and the magnitude.
Maybe with your group there, Mike, you can address that. And also another question in the chat box here, is there any info on homicide by age?
Yes.
And actually the prevalence of the youth population?
I'm beginning to prepare a press release from the health department. So what's interesting, if you look by race, the white non-Hispanic population, the average age of homicide victim is roughly about 39. For Hispanic and non-Black Hispanic, the average age for a homicide victim is 29. So they're young men for the most part, for all races.
Do you have a breakdown even of those under 18 to address, Mike, or maybe you can pop that in your work group for us?
Yes, I can certainly run that.
That would be awesome.
So Mike, I want to thank you for your presentation. I do want to do attributions to those few questions that were put in the chat box. Senator Moore had requested, had asked a question around, is there info on homicide by age? And the question of prevalence of youth was asked by Jackie Santiago. Other members of the work group, any other thoughts, any other impressions on Mike's presentation? I have a few questions myself that I want clarity on or would like a little bit more detail, but I want other members to weigh in.
And Mike, will this be made public, or is it available now public for folks to access?
It's available to you. I haven't put it out there yet, so it's available to the committee. Also, I had sent to the committee, I'm trying to think if I had it broken down by age. I put out a law enforcement newsletter about homicide. So there's a little more detail in that publication. And I will address the questions that you asked. So I will put that further and further.
And also the Asian Pacific Islander population?
Yes.
You can, Mike?
Yeah.
Because I don't believe we saw it representative in that sample, but it would be great to get that as well.
Sure.
Okay. Jeremy asked that last question about public availability of access to the document. Folks on the panel or members, you don't have to, you can use the chat if you like, but also if you want to raise your hand and also
feel free
to ask your question. Mike, one thing that comes to mind while folks might be is that when I'll go right to your last slide almost, when you talk about lifestyle. And one of the areas that that wasn't present on your slide that those of us that do this work know is a part of this is trauma history. And so the beauty about this particular committee and those that we hope to present before us would actually illuminate that connection between both victims of violent crime and those that perpetrate. Is this whole connection to trauma histories, not only from a violent crime, not only from gunshot victimization, but also intimate partner violence, when we talk about also child injuries and fatal child injuries and so forth, and you name it, a lot of other different ways that trauma has a way of altering one's ability to even engage in a way that might reduce their risk or prevent them from becoming a victim of a violent crime or perpetrating against someone else. And so, but definitely, we do want to dig deeper into that and make sure that this report illuminates the connection between this and trauma. I'm glad that you also pointed out some of the connection between drug use, because a lot of folks actually walk past that as well and not realizing that drug use is very prevalent among victims of violent crime, their family, within the community, you name it. And we do want to make sure that we highlight that in this report as well. And but thank you for going down that road.
Would we have any data on incarceration with that, Mike, as well?
It would have to be, I would have to go through narratives. Unfortunately, the current system doesn't have a checkoff box. I've actually recently, within 2021 cases, have gone through the Department of Justice program and looked up victims for convicted crimes and been adding it. So it's in text form. So it would take a little bit to collect that data. So I have data on victims that have convictions, but it's only recent for 2021.
Okay, and I see Jeremy Stein has a question for us as well.
Hey, Mike, how are you?
How you doing?
Good to see you. I had a question. I know you're charged with reporting injury and death, but do you have access to shooting information as well, and some of the information that you get from the police? Is it possible to get similar types of reports to see the broader view of the number of shootings that happen?
Well, that would be from two data sources. We also collect data on non-fatal shootings, in that it's particular to this homicide incident. So, for instance, 4 people were shot at an incident, 1 person died. We will have the non-fatal information for the 3 people who were injured and survived. So we have that data on non-fatal incidents. We would have to go to what we call our CHIME data. That is hospitalization data. The 29 hospitals in Connecticut, perhaps there's more, maybe it's our urgent cares. But we will have gunshot injuries from the ED also available. However, that will be a lag time of at least a year to 18 months. So we're looking at 2020 data now. So it would not be recent.
Okay. All right. Thank you, Jeremy, and thank you for that response, Michael. Jackie has her hand up as well, and then Carl, you may want to, if you'd like to hear from you on the question around publicly available data from hospitals. Thank you. Jackie?
Thank you so much for this presentation. I have a couple of questions. Actually, Pina and Jeremy both asked the questions I was going to ask prior, but I want to follow up on the one Jeremy had asked in terms of the non-fatal shooting victims. I'd be interested in knowing if there's any way to collect information on the number of victims that are initially shot that later become deadly incidents. I think that that would be great. And additionally, I think to gain a greater understanding for the kind of dynamics that lead someone into a life of violence and crime, I wonder if there's any additional information to support whether or not there were services accessed by these victims, employment, shelter, that kind of stuff.
Let's see. Certainly, well, for a person injured during a shooting, and if they should die later in time, it would be captured for sure. A lot of times, or not a lot of times, but occasionally we see a person who was a victim of a gunshot wound from years ago that has complications and dies further in time. They will be captured. It probably will be captured in there that, this person was injured at some point in time from a gunshot wound and later died from another incident in time. So that certainly is captured. As for services, from survivors or family members seeking service, probably the best agency to do that would be victim services through the state. They would certainly have a lot more information about services sought by survivors of homicide victims. That would not be captured by my system.
Thank you for those questions, Jackie, and Mike, your response. Carl, you just speak to your thoughts, or would you like to share around the role that hospitals can play with some of the data that that is required here or could be required to help us with our analysis?
Sure, absolutely. Thank you, Mr. Chairman. There are 26 acute care hospitals and 27 with Connecticut Children's Medical Center, 36 EDs total around the state, including the freestanding and off-campus emergency departments. Connecticut hospitals already provide a robust set of data to the state, and Mike made reference to, and terrific presentation, Mike, thank you, to the CHIME data system. So I know, working in partnership with the Department of Public Health, we can collaborate and try to get this advisory committee the information it needs. I've heard Mike say several times he'll go back and take a look at what he's got, and I appreciate the effort and support, but to the extent we need to do more, we're happy to engage, certainly in collaboration with the department and other agencies as well, including the judicial branch. Thanks, Mr. Chairman, and thank you, Mike.
Thank you.
Okay, thank you, Carl. James Dodderton.
I just wanted to add, in addition to what Carl mentioned, the HVIP collaborative that, of course, is led by Andrew Woods, has been able to put together some current hospital data, really responding to this kind of issue around the rise in violence in the context of COVID. So, Mike, wonderful presentation, and thank you so much for bringing the NVDRS data to the fore. We had a presentation by one of the folks of our small group working between 3 or 4 trauma centers on the rise in injury around COVID, pre-COVID and post-COVID, presented at the Connecticut American College of Surgeons meeting recently. And then we're happy to share that as it comes out, and happy to bring those collaborators again together to try to get more real-time data from the trauma registries associated with any violent injuries that are seen, of course, at the trauma hospitals across the state. So I know Dr. Shapiro, who's involved in that, Dr. Gates, who's of course represented by Dr. General on this committee, are all deeply involved in that work. Dr. Kevin Borup at CCMC. So we're happy to bring all of that to bear here.
Okay, thank you for adding that additional context, James. One thing that, Dawn, did you have your hand up, or that was a mistake?
I did have my hand up, but I'm not sure if this is the appropriate time or if it's the right setting. I just wanted to speak a little on what I guess what was her name? That's working with the DCF, and she had a question about the assistance of what the victims are getting, the victims' families are getting.
Right, Matt, right, Jackie Santiago raised that.
Okay. So just a little, I don't know if it's appropriate, but from where I'm standing, the assistance that the families are getting, they're not getting the assistance that's needed. Like I said to you, Andrew, on the call that we had on before, there's not a lot out there that's giving that type of assistance. Our young people, when we talk about the victims of the young people, The families are reaching out to get help before we get to this process of the homicide. So I don't know, you remember what I was talking to you about, families
Yes.
are reaching out, families are going to police departments, families are reaching out to their DCF workers to get help with these kids, these troubled kids. And they're told that their kids haven't committed a crime. There's nothing that they could do. The next phone call they get is to identify their child.
Right.
So I don't know if that helps answer that question, but there's no resources that's out there to help these people, which goes back to our legislations.
Thanks, Dawn. One of the things that, and thank you for raising that, certainly as it relates to, and I'm glad to see, Deborah Davis and Ebony as well on this panel or on this committee, because each of you and many of you are in the position to actually gain more data, information, stories, and insight on exactly what you just got through describing. And so in the coming weeks, we're really hoping that we will get those additional insights. So thank you for raising that. Appreciate it. And I'm looking forward to hearing more from your group.
All right.
There is one piece, though, I will add to that, in that question around, and Mike, you brought it up in reaction to Jackie Santiago's question, is that when it comes down to victims of violent crime or VOCA assistance, not all crime victims even apply. Put it this way, many are offered the assistance, and sometimes, depending on the circumstances, they may not apply. So therefore, on the judicial side, where those resources are managed, and Deborah Davis knows this well also, is that oftentimes you may offer that assistance and offer to provide them access to VOCA services. But again, depending on the dynamics, many may not apply. Then there are those that do, and then there's another process. So that would only capture some data, but it won't be the full picture. But what may capture more of the picture is what James Doddington pointed out in terms of if we can get hospitals, and here where Carl Schitzel comes in, to begin to talk with each other and share information and data across the system, we can determine which individuals have been treated, at least the best guesstimate of how many have been treated and then retreated because of an additional injury and so forth. And so, but that's a part of, again, why we're here. Any other questions or thoughts related to the presentation by Mike? I have just one more, Mike, and that is you mentioned legal interventions. And for the general public, they may not know what legal interventions are as it relates to homicides. Can you define that more clearer for everyone here on this committee as well as the audience, our general public? You're on mute, sir.
Yeah.
There we go. Can you hear me?
Yes, I can.
Okay, I'm back off. The CDC defines legal intervention as an agent of law, so that be law enforcement. It also can be military police. They use force to commit a homicide or kill someone. And it doesn't put into question the legality of the shooting or the homicide by law enforcement. It's just that action had to be taken by law enforcement, and we capture that.
Okay, and that again, that's helpful for folks to understand at least how that's defined, because for everything and what we uncover here, really there's an opportunity to present a strategy or a policy or a way by which we can help reduce or prevent some of these incidents. And so it's always good to understand what that number looks like and what are the circumstances behind that number. And then finally, my other question was around, thanks again for including the intimate partner violence in your data. Because those of us that do this work, quite frankly, there are others who do work around violent injury, and that's our folks who do intimate partner violence work, which is significant and is troubling just as troubling as community level violence. And again, even that intersects oftentimes. So thanks for highlighting that. And I'm sorry, one more. I would hope that we can also, and this goes back to the committee, Pina has reached out to law enforcement for that law enforcement presentation or forum, to where we would love to ask this question, and we will, which is around defining gangs. And so to have 2, 3, 4 different definitions out there, it would be helpful, and learn from law enforcement as to what they have done in the past to somewhat get a universal definition for that, or a way by which we can all be on the same page as it relates to the definition of gangs and sets and so forth. And of course, that's a whole gang presentation. But at the end of the day, we're hoping that we can get a more clearer definition of how folks are defining these gangs in setting or sets across the state. Any other final remarks, questions, thoughts? Okay. All right. Well, as it stands, our next steps here as a part of our charge is we do have the following work meeting dates: November 12th, November 23rd, December 10th to 22nd. Again, that information should be available to each of you, obviously, as well as our audience. And then, of course, we have those dates: the public safety hearing with law enforcement on November 5th from 5 to 8 p.m., as well as the public hearing, the general public hearing on November 17th from 5 to 8 p.m. And of course, those that are engaged in, such as under the leadership of Deborah Davis and others with that work group, you may be hearing more dates and times of which they will be doing further and additional engagement with the public.
Andrew,
Pina?
yep, I will be sending out the flyers that everybody can get out on social media and your emails and whatnot on those public hearings. We'll get those out to folks, and how to sign up, etc. And if you have anybody who actually wants to sign up ahead of time, please let me know and we'll get them on. And I'd just like to take this time to thank CTN for their continued coverage for us, Senator Moore for taking time out of her schedule to join us, as well as Stephen Hernandez from the Commission on Women, Children, Seniors, Equity and Opportunity for his continued support, and our whole team of administrators, including TJ Nuncio. And you, of course, Andrew, for leading us on this great endeavor.
Thank you. And I noticed that Jackie Santiago, Deborah, would like to also join your work group as well. And so, two of you, I'm sure, have each other's information.
Okay, excellent, excellent.
Fantastic.
Thank you.
And again, folks, anyone wants to be a part of another work group, you got the the capacity or bandwidth, by all means, let folks know. Okay. Yeah. Well,
and
Pina, thank you.
Yeah,
Thank
and excuse me, one last thing, just let us
Yep.
know if you when those meetings are, so that myself or someone from our administrative staff could be at those meetings with you to help offer some administrative support.
All right, folks, thank you very much. Enjoy your day, and we'll catch up with you soon.
Thank you.
Have a great
Thanks, Andrew. Thanks, Pina.
Thank you, Andrew.